Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Mount Pleasant, Texas. And today is Friday, December 4th. It's our Titus Regional Community Update. Over the last few days, we've increased the number of patients of COVID on our hospital and in this area. And I wanted to talk today just about our numbers and start there. We've talked about other things over the last few weeks and even the last month, but COVID has had a third surge in Northeast Texas, and Titus Regional is feeling it. I keep getting asking, how are we doing? Well, we're making it, and that's the one I keep emphasizing to everyone who calls me and texts me and I talk to. But I want to make sure Mount Pleasant, Titus County, and Northeast Texas knows, as a health system and a healthcare community, we are strained right now. We're strained with not enough beds, not enough staff, and not enough PPE. When this started in March and April and May, we talked a lot about what if. Well, we're coming across right now the what if, and that's what we're dealing with on a daily basis. I want to thank our doctors and our staff for the work through Thanksgiving week and this week that they did. It was phenomenal. The efforts and the selflessness that was given by our staff and our doctors during Thanksgiving this week to fight the increase of COVID in this area. Today we have 16 patients COVID-related on our floor, 4 in an ICU. Our ICU can only hold 4. So we've been maxed out all the last 2 weeks in our ICU. Some numbers we're watching, and when I say strained, here's the reasons why. We watch the region, and our region is Paris. And you'll see some things from the governor in the state of Texas that reference TSAF, and that is our RAC. That's our emergency region. And we are in F, that is Paris, Sulphur Springs, Titus, Texarkana, Atlanta. Those hospitals all work together. We look at our numbers as a whole on a daily basis, and everything we do, we are talking back and forth to see where capacity is. As you can see, only 6% of the ICU beds in our region are available. We have approximately 100 beds in our region in ICU, so we have 6 beds. A couple days this week, we only had 3 beds, and one of those beds was a Titus ICU bed, but it wasn't able to hold COVID patients, so we were full on COVID. So hospitals around us have gone on a divert this week, and our emergency room has been crowded. If you look at the orange line in front of you, you can see the increases of COVID ER visits. And yesterday it hit its highest that it's been in a long time, with over a quarter of the patients coming into ER yesterday in this region related to COVID. We're seeing the increase. So what does that mean? Well, the concerning thing is it's just not COVID. It's everything we do. With beds being limited, staff being strained, PPE being strained, and our ER being used for over 1/4 COVID in everything we do, it's a risk for everybody. It's a risk if you have a stroke or a heart attack or a broken arm or broken leg or a motor vehicle accident. Those things are at risk right now because of the shortage beds in our county, in our region, and across the state. We look at these same numbers on a daily basis. The executive team and the physicians who are on our task force look at these numbers consistently in the Dallas area and Tyler area. Of where we can transfer patients if we have to. And we're struggling right now, struggling to find where we can send those patients who are at a level that we can't handle at Titus Regional Medical Center. And that's concerning. So I'm going to encourage everybody. This is going to take all of us to get through, not just the medical community, not just our local government, not just state officials, but it's going to take everybody working together. As we go into the flu season, as we go into the cold days and into the winter, as we go into the travel season, we're going to have to do the things that we've started in the early spring and the summer. We've got to bring them back. You need to wear your mask on a constant basis. If you're sick, if you have any symptoms, I'm going to encourage you to stay home. We've seen some changes by the CDC in quarantining and those types of things, and those are the right things. So research that's being done, and we're seeing that out there, and I encourage you to follow those. But if you're sick or have symptoms or exposed to somebody, stay home, quarantine yourself. Do not expose your coworkers. Do not expose your friends. And please don't expose your family. That's what we have to be careful of as we go into this holiday season. Guys, I'm not telling us to stop living. I am telling us to be careful in everything we do. And we as a community have to own it. The numbers will speak for themselves. And I truly appreciate everybody who is wearing their mask and doing everything possible to mitigate the curve. But I am pleading for you and begging for your help as a community to help us as we fight this. One of the things that I'm grateful for is all-American testing. Last week, the company reached out and had been doing some testing, and we were able to work and put them in a building on campus right across the street here, 203 West 20th. There's their website right there. They have tested 150 to 200 tests almost a day this week. Been very busy this week. You can register online. They're open 7 days a week. And the team at All American Testing have several labs they work with. This is the PCR test. This is the cheek swab, but it is a PCR test. So they're able to get those turnaround times as 24 to 48 hours is their goal. They've been doing 13 to 15 hours. My mother used them this week, and a couple of my friends have used them this week, and we're able to get the results between 13 and 15 hours. So I would encourage you, if you have been exposed, wait a minimum of 5 days. And you can use the testing facility. If you have symptoms, use the testing facility as well. Contact your primary care doctor as well and work with him or her on your symptoms. Also, when you have a chance, I would encourage you, I'm very grateful to Dr. Craig DeLisi and Edwin for some of the things they did in the last couple weeks. If you go look at our Facebook and YouTube, they both did announcements and public service announcements last week, one in English and one in Spanish. Truly grateful to these individuals for doing it. Putting a little more oomph to what we give an update on a weekly basis. I can show you numbers, I can talk about what we're doing, but Dr. Craig DeLisi is a very well-respected primary care, not only in Northeast Texas, in the state of Texas, but across the U.S. He has served on several different things lately and has been asked to speak on COVID and the experiences they're seeing in the urgent care world, but he had a PSA on our Facebook, so I'd encourage you to go listen to it and take it to heart. Want to give a thanks to one of our local help. I told you earlier we're strained on PPE. Well, the state of Texas was able to allocate some PPE and some equipment to us yesterday. With being at 16 patients for the last few days, our average for 7 days has been 15 patients in the hospital. We sat at 16 today. It's the highest we've been at on a 7-day average since this started in late March, early April. But PPE is limited, but also is our ventilators. For the first time, ventilators are becoming at risk for us. We had to keep a patient in the ICU patient in the ER waiting a bed several times in the last 7 days. And that's not the world we want to live in. That's not what we want to do to take care of your family and your friends or even you. You can see there 2 ventilators. Big appreciation to Reese and our materials management team for working with the state and our RAC, our regional emergency team. They made a trip to Tyler yesterday to pick up not only 2 additional ventilators, so that increases our number from 12 to 14 ventilators to have them in the system, but also you can see boxes and boxes of gowns and gloves and masks and other things. I want to thank Big Tex and Randy. You can see Randy there yesterday allowing us to use that trailer. They told us when we arrived if we would have bought a smaller truck, they wouldn't give us all the supplies. But since we brought a big trailer, they made sure they filled it up and made sure the drive was worth it. So we truly appreciate the Big Tex and helping out locally to get this equipment and this information. It's only karma that this week, as we go into the increased number of COVID patients and the acuity increasing in our area, it is our National Hand Washing Week. And it's only appropriate that we talk about hand washing today. We talk about wearing your mask, social distancing, quarantine, testing, but also washing your hands, using your hand sanitizer on a constant basis. 20 seconds you see there. Big thanks to our marketing team for putting a lot of things out on Facebook this week. Just show different things about washing your hands and making sure you're sanitizing. But as one of the things you can do to help fight this disease and fight the crisis is just wash your hands and take that extra precaution and spend that 20 seconds a day at a time washing your hands. A couple things I just want to give you an update when we talk about the intensity and the acuity. Yes, remdesivir is a very powerful drug that we were able to get in midsummer, and it's saved lives. I have no doubt about it. When you talk to Dr. Thurman, Dr. Downey, and our physicians that are on our medical staff who are part of the task force, remdesivir does affect and it mitigates this disease and able to help inpatients, but it's only available in inpatient. I will tell you, yesterday we gave 17 doses in inpatient. That's the largest amount of dosage that we've done since the beginning of this crisis. So when we talk about the acuity, when I talk about the severity of what we're dealing with and talking about now, the fact that we gave 17 doses of remdesivir, well, first of all, the fact that we're able to get that much in inventory and keep it is a huge shout out to Ruth and our pharmacy for what they're doing to make sure our patients are taken care of. This is a hard to get drug right now to get the allocations, but for them to give 17 doses yesterday was huge. The other thing that they've done with remdesivir is 2 outpatient drugs. And we as a rural hospital have not gotten those allocations throughout the beginning of the crisis, but we have made sure that during the last few months that the state and the federal government knows the third surge that we're going through. So we were able to get 2 allocations last week, and I think I mentioned them. One was Regeneron, is a new drug that's coming out, and the other one was Bamlanivimab. And it's very tough to say, and I even practiced it before. But both of those are outpatient, very potent drugs that can be used to fight COVID-19. It's not available for everybody. It's a very strict group of patients that can take it. It's patients that are at high risk, and they have to have certain conditions to take it. It's a process of an infusion that has to happen. So it takes at least 2.5 hours to give the drugs on an outpatient basis. But it is the equivalent of remdesivir for an inpatient. This is an outpatient drug that we're able to do. Truly believe over the last 2 weeks, we've saved some lives as well. There's been some severe patients come in with minor symptoms, but they were high at risk of issues coming from COVID-19. So to put this drug out there and use it for them is a huge win, not only for our health system, but for our medical staff. As we move from COVID and we talk about the health system, I do appreciate everything everyone's doing in the community. And I encourage you to keep fighting with us and do your part as we continue to fight for you and fight for this community. I have to end on a positive note, though, and talk about something that we're very proud of at Titus Regional. Our second floor, our labor delivery, our pediatric, our NICU, our nursery is one of the foundations of our health systems. Over 1,000 babies are born in this health system on an annual basis. And for a hospital our size, that's a lot. So to the doctors we have phenomenal OBGYNs who participate with a phenomenal nursing staff as well. But this week, we had the state of Texas do a virtual survey of our labor and delivery unit for maternal services. We're already at NICU level 2, one of the few rural hospitals in the state of Texas that are at NICU level 2, but now we are going for a maternal services level 2 as well. I want to congratulate Dr. Mason, Cheyenne, and Tana on all the work that they did in preparation for this survey and that the teams that they work with did as well. The work that went into this survey and thousands of questions and protocols and policies were reviewed over 2 days. Charts were looked at, factors and birthing and those types of things was looked at as well as far as of all the medical records to ensure we're following protocols, we're doing trainings, we're doing simulations. And not only did they meet the criteria, the words that were used by the surveyors, who were some of the best OBGYNs in Texas who follow this, was superstars, they were all-stars. Irrespective if we were a rural hospital or a large urban facility, the work that's being done on the second floor is second to none. So I just want to say a shout out to all of our nurses and team members and our doctors involved on the pediatric, the NICU, and the labor and delivery. Everybody involved in maternal services for Titus Regional Medical Center. Just want to say thank you. And we have something of the many things we are to be proud of. This is just another one that we're so proud of what's going on in Northeast Texas as we are working for healthier tomorrows. Again, thank you for everything you're doing for us. Thank you for taking this to heart. Thank you for fighting with us. Have a great day. God bless.